Good morning, one and all. I am B. Shashwardhan from KL University. Now I'm pursuing in BTech second year. Yeah, coming to the data, I'm going to explain about the data science in health science, how it is helpful in healthcare and also in health science. Actually, data science is rapidly growing to occupy all the industries of the world. As of now, we know today, mostly our future is about only this data science and artificial intelligence, right? So it has a major role in the future and present. In this topic, we will understand how data science is transforming the healthcare sector. Yeah, we'll understand various understanding concepts of data science used in medicine and also how it is evolving in this health industry and also the medical industry. Yeah. Coming to the data science for medical imaging. The primary and foremost use of data science in the health industry is through medical imaging, right? Because of those only we are like X-rays, MRS, and scannings and CT scans. We are all because of these only we are able to see what is the issue that for a particular person, right? There are various images in image techniques like as I explained before, like X-ray, MRI, and CT scan. Yeah. All these techniques visualize the inner parts of the patients and and it finds some irregularities between the images and gives us the accurate output what actually it is and how it is different from the original part. Yeah, with the help of the deep learning technology in data science, it is now possible to find such microscopic deformities in scanned images, right? Yeah. Though image segmentation, it is possible to search for a different present in the scanned images. Yeah. Predictive analysis in healthcare. Yeah, as we all know that healthcare is important domain for predictive analysis. It is one of the most popular in analytics. A predictive model uses historical data, learns from it, find patterns, and generates accurate predictions from it. Means what it is doing means previously case we are having previous cases, health issue cases. Those all historical data. It grabs those all historical data, and um, we are teaching to the machine to learn from the historical data, and the machine itself, with the help of some algorithms, helps to find patterns and generates accurate predictions from it. It finds various correlations and association of symptoms, finds habits, diseases, and then make meaningful predictions. Predictive analysis is playing an important role in improving patient care. Yes, as we all know that chronic disease management and also increasing the effective of supply chain and pharmacy logistics. Because as it is a wide range, it's spread throughout the world and all the future depends upon the artificial intelligence and total these data science concepts, right? Yeah, yeah. Tracking and preventing diseases. Data science plays an pivotal role in monitoring patients' health and notifying necessary steps to be taken in order to prevent potential diseases from taking place. Yeah, data scientists are using powerful predictive analytical tools to detect chronological disease at an early level. What is the inner sense of this sentence is many of the data scientists are predicting an particular powerful predictive analytical tools and algorithms to cure the chronological diseases and as early as possible, and identifying the problem as early as possible so that we can cure very closely within short period of time. In many extreme cases, there are instances where due to negligibility diseases are not caught in early stage. This provides to be highly detrimental to not only the patient's health but also economic costs. as most of the diseases are cannot predicted easily, right? It will take some amount of it will take some time period to know whether he got a particular disease or he is infected with particular disease. So and the disease grows, the cost of curing is also increases, as you all know that. Therefore, data science plays a huge role in optimizing the economic spending on healthcare. By using these concepts of data science, we can easily predict the disease that he's suffering from. And also, there are several instances where AI has played a huge role in detecting disease in an early stage. Researchers at the University of Campines in Brazil have developed an AI platform that can diagnose this, Zika virus using metabolic markers. This is one of the example, and we have like this more examples. Yeah, yeah. Coming to the goal, our goal, final goal is to improve the cost care ratio. So, what is cost care ratio? Improve health operations, reduce fraud, waste, and abuse. These are all the some optimizations that that increases the health operations based upon the previous health operations every time the model get trained, and also it reduces fraud, waste, and abuse. Yeah, coming to the data quality and available, clinic data, behavior data, and pharmaceutical data useful but unavailable. Why these are unavailable? Because these are unavailable because we need to because we need to gain the proper certificates for that. So yeah, health insurance. 85% of Americans have it. It's a data. It is stored to track payments and address fraud. Yeah, data maintained for operation. Claims information, patient enrollment and eligibility, provider enrollment. This is the data maintained for operation. What required maintenance for operation. There's challenges and opportunities. Opportunities, fraud, waste, and abuse. These are the challenges and opportunities. These can be reduced as if we use the optimizable and optimizable concept, right? Yeah. Fraud. Billing for non-provided services, large-scale fraud. This is the fraud that is going to happening in this sector. That is going to happening in this sector. And coming to the social network analysis, estimate the risk of a provider fraud before making any claims by constructing social network. Means by the social network analysis, before making fraud, we can review from constructing by a social network, so that there is reduction of fraud, and reduction of fraud will be decreases because of the combination of the constructing social network, and it directly estimates the risk of a provider by fraud. Yeah. Next, coming to the temporal future construction. By looking at providing data over time, we can finish anomalies, increase in number of patients, taking patients with conditions different from their past profiles. This is the temporal feature construction. This feature construction, which helps to analyze the condition of the patient based upon the past patient's experiences. Yeah. Conclusions. What are the conclusions? Introduction domain. Big healthcare claims data, analyzed healthcare claims data, and on a country level. Analyzed healthcare claims data on a country level using state of art analytics for massive data. Problem was transformed to well-known analysis problems in the data mining community. Several approaches presented for identifying fraud, waste, and abuse. Yeah, these are the final conclusions that we have made. Yeah, there is several approaches for presented for identifying fraud. Several approaches we have. So those approaches we have discussed already in the above slides. Problem was transformed to well-known analysis problem in data mining community. Yeah, yeah. Um, Coming to the summary, what we have learned in this, in the end, we conclude that data science has many applications in healthcare. Yeah, we have many. There is many applications in healthcare. The medicine and healthcare industry has heavily utilized data science for the improving lifestyle of patients and predicting the diseases at an early age. Yes, this statement is correct um, because because of the applications of data science and the concepts of data science, many medical industries are applying these techniques to predict the diseases as early as possible, and makes easy for the patients for their health. So it also reduces the cost, and also it can stops by increasing the by increasing the infection along. So we conclude that data science has many applications in healthcare, and also data science for improving lifestyle of patients and predicting diseases at an earlier stage, as we have discussed in the earlier. Now, furthermore, with the advancements in medical image analysis, it is possible for the doctors to find out microscopic tumors that were otherwise hard to find. With advancement in medical images analysis, it is possible for the doctors to find out microscope tumors that were otherwise hard to find. Because of this only, they are finding microscopic tumors. Those are all not identified by normally. Because of this data science techniques, they are identifying those microscopic diseases, and they are curing the patients by providing the by providing their by providing particular medicines for them based upon these data science techniques. Without these techniques and data science concepts, there is I think medical industry will lose a yeah it is little bit somewhat backward. Yeah, so I hope you understand, and also you can find that there is a wide range of uses of this data science in science medical science, and not only in medical science but also in various sectors and various industries. It is useful also for banking, also for banking in the banking sector, and also medical, and also for IT industries. So because of this only, human work is going to reducing, and more stress is not going to happen on the humans. So this makes a lots of impact in the society, which is very helpful. So I hope you all understand what is the main theme of this data science on the back end of the medical industry, and what's going on, and how patients will get cured as early as possible with these techniques, and how it is helpful to the doctors, and how to identify the microscopic infections um, that are hiding the patients. And we learn how new diseases are predicted based upon the previous patient's diseases, and how at what accuracy these diseases are going to infect more, or they will stop there. So, by all doing this, we are using some machine learning concepts and neural networks. These are all the subparts of data science: artificial intelligence, neural networks. Yeah, these machine learning neural networks. These are all the subsets of data science. So, it is like a whole family: data science, artificial intelligence, machine learning, and artificial neural networks. So it impacts a lot in medical science. So thank you, I hope you all I hope you all understand this, and please mention your questions in comment box if you have any, or if you need any requirements, or if you need any other further videos regarding the data science or any machine learning data science or any concepts. I will try to implement based upon your comments. So feel free to ask questions regarding this. Okay, thank you so much, guys. Yeah.